of this. Maybe
Okay.
I should call
I
you.
didn't understand anything of this. I could not follow anything of this. Maybe I should follow you then.
Yeah, okay. The question is about the structure of the hospital committee of blood transfusion.
Okay.
What about the organizational structure in a hospital for the committee for blood transfusion? Can you
Usually this hospital transfusion committee is a hospital committee ordered by the board of the hospital, the director of the hospital, in which usually the head of the blood transfusion service is the chair of this meeting. Participants are people from the laboratory, hematology department, internal medicine, a surgeon, pediatrician. So many doctors and, of course, also nurses from the hospital are participants in this meeting. Here in Europe, also. We are from the National Blood Transfusion Service here in the Netherlands, so one of our physicians, so I'm participating in 10 different hospital transfusion committees. So the structure of this committee is a hospital-based committee giving or making all responsibilities for transfusion clear, and is responsible for all transfusion practices in the hospital.
Okay, okay. Thank you, guys. I think the answer is very clear for us. And also, how about Dr. Edi? Any comment? Ada komentar Dr. Edi mungkin terhadap jawaban Dr. Hans? Oke, tadi mungkin ada mau dibantu, ada apa namanya chatting yang bisa saya buka tadi mungkin dari Dr. Rudi. Dibuka ya. Saudara bisa bacanya ya?
Salah.
Nggak bisa. Oke. Oh iya. Okay. There is another question asked from Dr. Rudy. In case of autoimmune disease, the question is in children, sometimes the blood group will change in it, and so the question is, how can then we determine the blood group correctly? I will try to repeat the questions. In case of autoimmune disease in children, sometimes the blood group will change. So how then we can determine the blood group correctly?
Yeah. So sometimes the APO blood group will change, and indeed this is a very difficult case.
Hello?
So this is difficult yeah. So this is difficult to check, and when there is no blood group to be determined, what I would do is I gave O positive or O negative blood, but O negative is very rare, of course, when there is blood needed. So always, what my advice always is in autoimmune disease, try to avoid blood transfusions as much as possible, and unless you can't do anything else.
Okay. Yes. So, what do you think with the change of the blood group in children with autoimmune disease? I mean that it is changed just phenotypically or just changed also genetically? Because could be, I'm just thinking that it's just phenotypically, then could be someday or next time it could be this, then the original blood group will be also back to our mission. What do you think, Hans?
Yeah, genetically they will not change anything, of course, unless such a child receives hematopoietic stem cells. Then you can have a change. Otherwise, you will not have a change of blood groups. So it's a phenotype change of the blood group, and this can be changed back to the old blood groups.
Okay. The question is, in case of transfusion reaction in a patient in our hospital, then what is the role of our blood bank, or what should a blood bank do for this case?
Okay, in case of a transfusion reaction, let's say there is a hemolytic reaction or something like that. What is needed is to stop, as the blood component is still being administered, you should stop immediately and hang saline or glucoses to this infusion and start doing your job as a doctor in trying to avoid as less damage as possible. For the transfusion, what is always needed is to send this back to the hospital blood transfusion service and do all pre-transfusion checks again with the old blood, but also with freshly taken blood. So there must be some new tubes coming back from the nursing ward where the patient is, going back to the transfusion service and do all checks again.
Okay.
So the old, also with the old cross-matched blood, which is usually should be stored for 7 or 8 days or so on the blood bank or the blood transfusion service, and then do all checks again. So repeat all checks with old and new blood.
Okay.
In case of something else, you could also do all kind of other checks, sterility checks, like that. So yeah.
Okay. And then how about the reporting system in hospital? I mean, after trying to recheck all of the pre-transfusion testing for the blood between the donor and the patient blood, and then the blood bank got the result, and then how should the blood bank do after this? I mean, for reporting to the janitor or to the clinician, or what should you do? What should it do from the blood bank?
Yeah, what should be done, of course, is two things. Here in Europe, you have to notify the official authorities, so you have a hemovigilance system, which I think is not present yet in Indonesia or in surrounding countries.
Yeah.
That's one thing. So the official report to the health authorities. So the second thing is, of course, what should be done is making sure that the patient and the physician treating the patient is being notified that from the results from the blood transfusion service. What you also could do, and what is being done in many countries, also including in the Western countries, is, let's say you find an anti-cal after this transfusion or whatever was missed, something before. Then you give information to this patient that should be kept by the patient also, but also in your own reports from this patient that there is an anti-cal or an anti-kit or something what's present. So two things is notification of the authorities or notification of the patient and the treating physician.
Okay. Yes. Okay. Thank you, Hans. Any other question from participants? Ada pertanyaan dari peserta? Okay, Dr. Hans Vrielink, I think it will be the end of this session. Again, very comprehensive lecture, and thank you very much for your time. to join us in this session.
You're welcome.
I hope that you can have me again in the next session. I will inform you later. My greetings to friends there in Sanquin and also to your family. And see you in Seoul, I think. Okay. See you, Han. Terima kasih. Selamat.
See you. Have a nice day. Terima kasih.